up using, at least initially, is an over-the-needle intravenous cannula. So maybe a 23 or a 21 gauge over-the-needle intravenous cannula, introduce that into the urethra and flush through with large volumes of saline to begin with, to try and just flush out any obstruction that may be present there. And if flushing out the urethral lumen doesn't relieve the obstruction, then we would want to progress perhaps to retrograde flushing, where we occlude the urethral orifice, digital pressure, occluding the urethral orifice over the intravenous catheter that we've put in place, and then infuse sterile saline to try and dilate the urethra and push that blockage back into the bladder. So it's a stepwise approach to trying to relieve the urethral obstruction, all the time trying to minimize any trauma to the urethra. Once we've relieved the obstruction, we want to flush out the bladder, introduce the catheter, keep flushing the bladder out, putting sterile saline in, removing it until what we're getting out is relatively clear, relatively clean. Get rid of as much of the debris from the bladder as we can. Trying to make sure then that the cat doesn't re-obstruct. Do we leave a catheter in or do we take it out? Again, there are no hard and fast rules about how to do that. All we can say is that the longer that you leave a catheter in place, the more irritating that is to the urethra, the more chance there is of exacerbating any urethral trauma, increasing urethral edema, increasing urethral spasm. So better to leave the catheter in for as short a period as possible, compatible with trying to get the cat improved as quickly as possible. So with Charlie, we did cystocentesis. We put him onto intravenous fluid therapy because of that severe azotemia. We then anesthetized him. We got him onto some bicarbonate to correct the acidemia and to help correct the hyperkalemia. And of course, just relieving the obstruction, getting onto intravenous fluids. That does a huge amount to relieve that hyperkalemia. We did put an indwelling catheter in. We left it in for 2 days because he was quite difficult to unobstruct. In very simple cases, straightforward cases, we try not to leave a catheter in. If it's a little bit more difficult, we will often leave one in for a day or two. So we left one in for a couple of days, put him onto antiemetics, and he actually did remarkably well. Everything resolved very quickly. The other thing that we will use in these cases is spasmolytics. Irrespective of the cause of the urethral obstruction, irrespective of whether or not we're going to have to use an indwelling catheter, urethral spasm is likely to be a component of what's going on in these cats. So right at the start, we will, in a cat that presents with urethral obstruction, we will get on board some spasmolytics. And what we're talking about here is a combination of skeletal muscle relaxant and a smooth muscle relaxant, because the urethral sphincter has both of those components in a cat. So both of those are required to produce good relaxation of the urethral sphincter. And so we'll try and get those on board right at the start when we're dealing with an obstructed cat, and hopefully that's going to help the recovery. In terms of long-term management of obstructed cats, we need to try and identify again what the underlying cause is. If it's urolithiasis, again, we know how we're going to approach management of urolithiasis. If it's a cat with functional obstruction, urethral spasm, probably most of those cats have some form of idiopathic cystitis, so we're going to treat them as idiopathic cystitis cases. And indeed, the cats that present with urethral plugs, probably many of those also have underlying idiopathic cystitis. That's probably part of the reason for that mucoprotein matrix that helps form the plug. It's probably partly inflammatory proteins, probably partly vasodilation, etc., that's going on in the bladder wall, leakage of proteins from serum, etc. But it may well be idiopathic cystitis in many of these cats. Crystals, though, often form part of the obstruction. crystals tend to get trapped within that mucoprotein matrix that forms the plug. It's not that crystals are causing the urethral obstruction, but they're contributing to it. So this is another situation where I think it would be perfectly appropriate to use a diet that is designed to undersaturate urine, to minimize the production of struvite crystalluria, and again to monitor these cats, to look at them on a long-term basis to make sure that we are achieving that goal. I think that's reasonable in cats with urethral obstruction. And in the final 10 minutes that I have to talk, I just wanted to touch on a few aspects of idiopathic cystitis as well. And idiopathic cystitis clearly is the disease that we diagnose most frequently in these cats, but it is a disease that we diagnose by exclusion. Only by doing appropriate investigations can we rule out the other causes and at least be reasonably confident then that we are dealing with an idiopathic case. This is a typical example of a cat with idiopathic cystitis. 7-year-old female neutered domestic short-hair cat living with 4 other cats in the same environment. Quite common with idiopathic cystitis to come from multi-cat households, being fed mixture of dry food and wet food. 2 years, chronic history of recurrent signs of lower urinary tract disease. She was referred in to us for investigation. Urinalysis was largely unremarkable. Urine culture was negative, mild inflammatory sediment, and some struvite crystals, which again we know are normal in many cats, particularly cats that are being fed some dry food. We did some radiographs, some diagnostic imaging with her. The only thing that we could identify, won't show up here very well, is just some mild thickening of the bladder wall on pneumocystography. Could be edema, could be inflammation, could be muscle hypertrophy, we can't tell, but it's something that we see quite commonly with many different types of lower urinary tract disease, including idiopathic cystitis. But by exclusion of those other major diseases, we have a diagnosis of idiopathic cystitis. We diagnose this by excluding the other recognized causes. We know the clinical signs are very similar to any other cause of lower urinary tract disease. We know too that most of these cats will spontaneously resolve within a few days. They may get recurrent episodes, but most of them resolve within a few days. We know too that many of these are stress-related, or that at least appears to be a component in many of these cats. And we know too that crystalluria is not associated with idiopathic cystitis. Many cats with idiopathic cystitis do have crystalluria, but they are not causing the cystitis. It just reflects the fact that many cats do produce concentrated urine that may be supersaturated. What do we know about the underlying cause of idiopathic cystitis? Well, almost certainly this is not a single disease entity. Almost certainly we are dealing with a variety of different diseases that at the moment we lump together as a syndrome that we call idiopathic cystitis. We do recognize some abnormalities in these cats from studies that have been done, different studies that have been done. 2 major abnormalities have been identified. One are local changes within the bladder. These cats appear to have a deficiency in glycosaminoglycans in the bladder. And that, if you like, is the mucin layer that lines the bladder, so it provides a protective layer that overlies the epithelium in the bladder. If that is lost, then that's one of the protective layers that is lost. It allows urine to come into contact with the urothelial cells. That may be irritating, may cause damage, may incite inflammation, and so on. So we have local changes going on within the bladder that we can identify in these cats. And also in these cats, studies that have been done suggest that a number of these cats have high levels of circulating catecholamines. Again, evidence that stress may be a component of this disease. But interestingly, although they have high levels of catecholamines, suggesting that they are stressed, their adrenal responses to ACTH are poor. So their cortisol responses to ACTH are subnormal. High catecholamine levels, but subnormal cortisol levels. So there is an uncoupling of those pathways that are normally present together in a stressed individual. Interestingly, that these changes are also recognized in humans with interstitial cystitis. And so there's a lot of interest in cats with idiopathic cystitis as a potential model for humans with interstitial cystitis. Lots that we still need to learn about this disease, but we're beginning to at least have some idea of underlying changes that may be going on with these cats. It doesn't help us a huge amount when it comes to treatment, it has to be said. We understand something of the abnormalities that are going on, something of the underlying changes in these cats, but it doesn't necessarily help us a whole lot when it comes to treatment. And when it comes to treatment, as with most other medical diseases, we reach for a drug. We want to find that drug that is going to make the difference in cats with idiopathic cystitis. Well, this slide lists most of the drugs, at least, that have been looked at in controlled clinical trials in cats with idiopathic cystitis. And the bad news is that every one of these drugs that has been looked at in a controlled clinical trial for the treatment of idiopathic cystitis has been shown to be no better than placebo. No better than placebo.